It has never been easy to be a young adolescent with social pressures along with physical and emotional changes. But starting in 2020, the coronavirus pandemic pushed teen mental health over the proverbial edge, leading to what the American Academy of Pediatrics called a national state of emergency. 3 years later, the impact on teens is still with us, but so are many new programs designed to help them. Nancy Chen has more.
What your generation experienced as a result of this pandemic, we still don't understand fully.
In Baltimore's Sandtown neighborhood, between classes at the Youth Opportunity Center, a particularly important lesson.
Other people and their stigma, let them live in their box, right? You got us, you got your community here. That's what I would focus on. Megan and Dr. Fink.
This is the Health and Education Training, or HEAT Corps, a team of faculty and students from Johns Hopkins University.
These 3 lines here are all crisis lines that you can reach out to if you're in a moment of crisis or panic.
The group visits schools throughout the city to discuss the science of COVID-19 and its continuing impact on social and emotional well-being.
By show of hands, how many of you are stressed?
We sat down with students Miracle Washington, Diana Perez, Cleveland Melvin, Eugene Hawley, and Derek Wright.
The pandemic, it just really it messed my whole head up, my mindset, the way I thought about things, and just everything in general.
What are the healthy ways that we can reduce stress?
I was going to say working out.
Yeah,
it helps.
That's my stress reliever, absolutely.
I would say crying and letting go of some things,
We all lost someone. It was just strenuous on all of us. And then I noticed that when we did come back to school that I was more introverted, even till this day.
This scenario is playing out across the country. For years, mental health has been worsening among teenagers, but the pandemic amplified those problems. According to new data, 37% of high school students reported experiencing poor mental health, and 44% reported feeling persistently sad or hopeless. As schools shut down in spring of 2020, Johns Hopkins leaders across disciplines came together to create the HEAT Corps.
So we appreciate what you're doing.
Educator Annette Anderson and Dr. Panagi Scalia-Satos, a critical care physician, helped lead the charge.
Well, I think we need to give some greater consideration to the fact that simply putting young people back into school buildings did not erase the mental health issues that were generated because of the pandemic.
And that takes a tremendous amount of courage.
The program initially helped students and their families navigate medical questions, but one topic kept resurfacing: mental health.
Address stigma for ourselves. It's really important to first honor how you feel. Well, when you honor how you're feeling, you acknowledge it.
What is the solution here?
You're realizing there's not a support, there's not a sense of, do you have my back? There's not a sense of trust. I mean, when we finished today's lesson, they wanted to join internships with us. They wanted to continue working with us because for many of them, that might have been the first time people paid attention to how they feel. We are feeling this void that while we enjoy doing this, don't get me wrong, we realize we need more resources.
They say the long-term effects of limited socialization aren't clear yet.
We were thinking, oh, well, they'll miss the prom. Oh, well, right? They'll miss their prom.
Graduation.
They'll miss their graduation, but they'll be okay. But we assume that, right? We have pushed that onto our teens, and they're pushing back and saying, no, we're not okay.
Especially after 2 years of the pandemic, it's just not a great time for them. The G.I. Joe fallacy is this mistaken idea that knowing something is half the battle.
Mental health has long been a focus of Yale professor Dr. Laurie Santos, who hosts the Happiness Lab podcast. Her class, Psychology and the Good Life, is the most popular in Yale's history.
Every time you hear that self-talk, think, would I tell my best friend that? And if you wouldn't, commit to talking to yourself in a different way.
And more than 4.5 million people have taken a free online version of the course. Santos released an adaptation of it for teens earlier this year, with more than 100,000 people already signing up.
Every day I would get up and teach my Yale students, and I would think, man, I wish they just learned this stuff earlier. When they really start to run into some of these mental health issues, we could give them strategies they could use to navigate not just high school, but into college and beyond. Part of what we're going to tell you about in this class is what I'm going to refer to as Psych Pro Tips.
Teaching skills that help teens manage the changes in their lives.
The class is really all about behaviors you can change to feel happier, like engaging in more social connections, sleeping more, but also ways that you can change your thought pattern, which is really strategies that come straight out of cognitive behavioral therapy.
This is meant for
Strategies the teens back in this Baltimore classroom say could help them for years to come.
What did you take away from the session today?
Is so many more solutions to the problems that we might think are complicated, but we actually can simplify it in just a few easy steps.
I personally realized that during my first 2 years of high school that I suffered from like chronic anxiety. I overcame it, but I didn't realize that until this meeting. So it kind of like helped me awaken to something that I was dealing with that I didn't even know that I was dealing with.
You'll be the first one, the inaugural.
Anderson and Galeasato say that's why their work is more important than ever.
What is there to be hopeful about in this conversation?
I feel like our teens are resilient. I also think that they care about one another. So there's a great deal of just compassion that our young people in this generation has really developed for each other.
So my hope is these youth that are about to be the leaders of tomorrow are going to carry in and saying things need to change from a mental health perspective. That's what I'm hoping.
For CBS Saturday Morning, Nancy Chen, Baltimore.
I like what she talked about, the G.I. Joe fallacy.
Yes.
And they always said knowing is half the battle, knowing you have a problem. And it's like, no, that's not right. Like, yeah, I might know that I'm depressed or don't feel well, but that's like 10% of it.
Yeah, right.
There's a lot of work I still have to do, and I have to figure this out. So I thought that made me think.
Yeah, got to find those solutions. It's like building human infrastructure to deal with life. I mean, we don't invest in it. We don't invest in it, you know, in real infrastructure. Really important to invest in the human being.
Yeah, not just the teenagers, too, even younger kids, too.
Everybody.
Yeah,
After
everybody.
the past few years.
Thanks, Jeff.